Dieses Video präsentiert Ihnen Eumedix.
Train-of-form monitoring of the facial nerves. When performing train-of-form monitoring on the face, two branches of the facial nerves are usually utilized, namely the zygomatic branch resulting in the activation of the orbicularis oculi muscle and the temporal branch resulting in the activation of the corrugator supercilii muscle. Factors relating to train-of-form monitoring of the facial nerves. Unimpaired intraoperative access to the facial nerves is assured. However, it comes with great risk of direct muscle stimulation as facial nerves and muscles share a close proximity to one another. Great care should be taken when placing electrodes on the face. We strongly advise locating the exact position of the chosen nerve using the Stimpod nerve mapping pen before placing the cathode. Stimulatory response can be observed visually and objectively. And it should be noted that correct stimulation of these two nerve sites are technically difficult to achieve, and the outcome is frequently unsatisfactory. Nerve stimulation versus direct muscle stimulation. Due to the proximity that the zygomatic and temporal branches share with the mimetic muscles, direct muscle stimulation is unfortunately very likely. Great care should thus be taken to ensure that the electrode placement has good discrimination of the targeted nerve by monitoring the resulting muscle contraction. For the zygomatic branch, we are looking for the resulting muscle contraction of the orbicularis oculi, and for the temporal branch, the resulting muscle contraction of the corrugator supercilii. Electrode placement. As previously explained in our supramaximal stimulation video, the placement of the stimulating electrodes are critical in achieving a supramaximal current for the purpose of ensuring reliable monitoring results. In order to avoid any anatomical anomalies as well as ensure correct electrode placement, we recommend utilizing the Stimpod nerve mapping pen to locate the most superficial aspect of the chosen facial nerve. We specifically recommend that the nerve mapping pen is used at a current between 8 and 10 mA. If a strong contraction is found at this current intensity, it can be assumed that a monitoring current of 30 mA will therefore sufficiently qualify as a supramaximal current. If the current is increased beyond 30 mA, however, chances are higher to solicit a response from the nearby muscles. The cathode or black electrode should then be placed on the most superficial aspect of either the zygomatic or temporal branch of the facial nerve. Electrode polarity. It's important that the cathode, rather than the anode, is placed on the most superficial nerve site in order to cause depolarization as opposed to hyperpolarization of the nerve. Depolarization of the nerve requires less current than hyperpolarization, therefore making a supramaximal current much easier to achieve as opposed to if the polarities were reversed. Accelerometer application. When stimulating the temporal branch, the response of the corrugator supercilii muscles should be monitored and the accelerometer should be secured above the eyebrow on the median half of the face. This is done by removing the accelerometer strap and applying double-sided tape to the bottom of the accelerometer. When stimulating the zygomatic branch, the response of the orbicularis oculi muscle can be monitored if the accelerometer is secured laterally above the eyelid. The accelerometer contains a three-dimensional technology which allows for the accelerometer to be oriented in any way and therefore requires no calibration. Once the setup is complete, a train-of-4 test can be done in order to observe the patient's muscle contractions. The TOF ratio should be well above 100%. Please note, it's important to verify that the current setting is roughly the same as the current delivered. If the current delivered is much less than the current setting, there's a problem with the electrode-skin interface. Possible causes include a need for skin preparation or a defective electrode. Thank you for watching this instructional video on train-of-form monitoring. For any further information on our products or neuromuscular monitoring, please visit our website at www.xavant.com.
Dieses Video präsentierte Ihnen Eumedix.